Diabetes mellitus type 2, which was previously known as non-insulin-dependent diabetes mellitus, is a metabolic disorder and is also known as adult-onset diabetes. It is characterized by high blood sugar or glucose in the framework of insulin resistance and comparative insulin deficiency. In the beginning, it is usually managed by changes to the diet and exercise. As it progresses, medications might be needed to control or manage. Something that can occur in type 2 diabetes is something known as non-ketonic hyperglycemia, a metabolic derangement that occurs when there are unusually high serum glucose level without ketoacidosis present. Long-term complications associated with high blood sugar may result in an increase in kidney failure, amputation, heart attacks, and strokes. According to the American Diabetes Association, the most common form of diabetes is type 2 diabetes. There have been millions reported with the disease, numerous others unaware they have a high risk for developing it. It is most common amongst Asian American, Native Americans, Hawaiians and other Pacific Islanders, Latinos, African Americans and the elderly. Type 2 diabetes causes. Type 2 diabetes occurs when the body does not make sufficient amounts of insulin or the cells disregard the insulin. Insulin is needed by the body to be able to use glucose for fuel. When you consume food, the body breaks down all the starches and sugars and converts them into glucose, which is the basic energy source for cells in the body. Insulin transports the sugar from the blood and leads it to the cells. When there is a buildup of glucose in the blood instead of it going to the cells, this can lead to diabetes complications. Managing diabetes. The American Dietetic Association has specific dietary guidelines for with type 2 diabetes in improving their blood sugar levels by doing the following: consuming fewer calories, consuming an even amount of carbohydrates, consuming healthy monounsaturated fats instead as an alternative to carbohydrates, consume 6 or more servings of starchy vegetable, beans and grains. This helps keep the body's systems and heart healthy. Limit sweets and fats, consume 3 to 5 servings of vegetable per day with varieties of either fresh or
frozen.
Learn more at type-e-diabetes.info.